We don't have too much time left, but I really want to touch upon this aspect. You serve as a chief experience officer, right? And from your perspective, what do you see some of the barriers and the patients, especially the melanoma patients, face? And how, what are you guys doing to sort of close that gap?
There's a few. I'll make one modification. So I'm the physician partner to the chief experience officer, which means I get to bask in some of the glow, but also I get to work from the clinical perspective and leading that work. But I'm passionate about it's not just about the quality of the care, it's how our patients experience it, right? Because that does influence it. You can have the best surgeons, you can have the best clinicians, you can have the best diagnoses, but if you don't have those care relationships, we're really not going to get to where we need to be. So, especially for patients, for melanoma patients, it is different, right? It is a different set of circumstances, of worry, of things that people are thinking about than if you break your arm, for example,
Sure.
or you have high blood pressure, or diabetes. I think we have to recognize that there is a unique set of factors, and there's been some interesting writing. For example, if we just take one of those factors, the financial impact of
Yeah.
cancer diagnosis, right? This
Yeah.
concept of financial toxicity, that's one where, again, we think of ourselves, our jobs and our role as doctors. What is the way that finances interplays? It absolutely should, right? It absolutely should. If we don't recognize the financial realities, if we say broader, what we call these social determinants of health, the sort of the way that these other aspects of your life influence the way that you receive health care, that you are able to take care of yourself, that you're able to do certain treatments or not, then again, we're not going to get anywhere. I think it's a recognition that the patients who sit in front of us are patients even outside of that exam room. There are people in this world, and how do they experience the world? How does that interact with what we're recommending in terms of treatment or procedures? And even to the point of, are they able to follow through on those recommendations? Can they pay for their medication? Can they access it? Can they get back in for their follow-up visit if they have to drive 3 hours away? I don't know, right? So those are the ways that at least in my work now, really has broadened the view to, as doctors, yes, we're involved in that diagnosis, the treatment, the plan, the healing, all of that stuff. But boy, unless we open our eyes wider, we're really not doing our patients the service that we should, because we need to look at them as humans in the world, not just as people sitting in front of us in the exam room.
I think this is one of the most important thing as a clinician. Sometimes we forget, we focus on the disease, right? We forget sometimes there's a patient, there's a real person in front of us.